Question 1. A nurse is assessing a patient experiencing acute anxiety. What is the priority intervention? A. Encourage the patient to express feelings. B. Administer prescribed anti-anxiety medication. C. Ensure a calm, quiet environment. D. Provide educational resources about coping strategies. Answer. C. Ensure a calm, quiet environment. Question 2. Which of the following is an example of a task that can be delegated to a nursing assistant? A. Administering medication to a patient with hypertension. B. Assessing a postoperative patient for signs of infection. C. Measuring vital signs for a stable patient. D. Developing a care plan for a newly admitted patient. Answer. C. Measuring vital signs for a stable patient. Question 3. A nurse is planning care for a patient with severe depression. What is the most important aspect of the care plan? A. Encourage the patient to engage in group therapy. B. Develop a safety plan to prevent self-harm. C. Increase the patient's fluid intake. D. Focus on promoting social interactions. Answer. B. Develop a safety plan to prevent self-harm. Question 4. Which of the following should be the nurse's first action when a patient is at risk for suicide? A. Encourage the patient to discuss their feelings. B. Notify the healthcare provider. C. Remove any harmful objects from the patient's room. D. Provide the patient with resources for coping strategies. Answer. C. Remove any harmful objects from the patient's room. Question 5. A nurse is working with a patient who has a history of substance abuse. The patient expresses a desire to stop using drugs. What should the nurse do first? A. Suggest immediate inpatient rehabilitation. B. Assess the patient's readiness to change. C. Advise the patient to attend a support group. D. Give the patient information about detox programs. Answer. B. Assess the patient's readiness to change. Question 6. A patient with schizophrenia is experiencing delusions. What should the nurse do to promote patient safety? A. Challenge the patient's delusions. B. Provide reassurance and offer reality-based comments. C. Leave the patient alone to process their thoughts. D. Ignore the delusions as they are part of the illness. Answer. B. Provide reassurance and offer reality-based comments. Question 7. Which of the following is an appropriate delegation for a nurse to give to a licensed practical nurse, LPN? A. Performing a comprehensive assessment of a newly admitted patient. B. Administering medications to stable patients. C. Developing a care plan for patients with complex conditions. D. Teaching a patient about disease prevention. Answer. B. Administering medications to stable patients. Question 8. A nurse is caring for a patient with borderline personality disorder who is becoming agitated. Which of the following actions should the nurse take first? A. Set clear boundaries and limits with the patient. B. Use physical restraint to prevent harm. C. Ignore the patient's behavior to avoid reinforcing it. D. Ask the patient to leave the facility for a short period. Answer. A. Set clear boundaries and limits with the patient. Question 9. When assessing a patient with post-traumatic stress disorder (PTSD), what should the nurse prioritize? A. Encourage the patient to recall traumatic memories. B. Assess the patient's coping mechanisms and support system. C. Provide direct therapy for trauma-focused care. D. Avoid discussing the trauma to prevent triggering symptoms. Answer. B. Assess the patient's coping mechanisms and support system. Question 10. A nurse is planning care for a patient with a history of self-harm. What is a priority intervention for this patient? A. Develop strategies to help the patient control impulsive behaviors. B. Focus primarily on teaching healthy coping mechanisms. C. Provide the patient with a detailed list of activities for the day. D. Avoid discussing self-harm behaviors unless the patient initiates it. Answer: A. Develop strategies to help the patient control impulsive behaviors. Question 11. Which of the following is the most effective way to manage a patient experiencing severe agitation? A. Use a calm and non-threatening approach to de-escalate the situation. B. Restrain the patient immediately to prevent harm. C. Administer antipsychotic medication as quickly as possible. D. Ignore the behavior and continue with normal tasks. Answer: A. Use a calm and non-threatening approach to de-escalate the situation. Question 12. A nurse is caring for a patient with depression who is not eating. What is the most appropriate nursing intervention? A. Force the patient to eat to prevent malnutrition. B. Encourage small, frequent meals and snacks. C. Offer a variety of foods to increase the patient's appetite. D. Ignore the patient's eating habits as part of the depression. Answer: B. Encourage small, frequent meals and snacks. Question 13. In planning care for a patient with obsessive-compulsive disorder (OCD), the nurse should focus on which of the following? A. Limiting time spent on rituals to reduce anxiety. B. Encouraging the patient to stop performing rituals. C. Providing education about medication side effects. D. Encouraging participation in group therapy. Answer: A. Limiting time spent on rituals to reduce anxiety. Question 14. A nurse is assessing a patient who has been diagnosed with a major depressive disorder. The nurse should prioritize which of the following? A. Determine the patient's risk for self-harm or suicide. B. Encourage the patient to engage in physical activities. C. Focus on the patient's social interactions with others. D. Promote a structured daily routine for the patient. Answer: A. Determine the patient's risk for self-harm or suicide. Question 15. A nurse is working with a patient diagnosed with anorexia nervosa. Which of the following actions is most appropriate? A. Monitor the patient's weight frequently to assess progress. B. Provide the patient with a detailed meal plan to follow. C. Ignore comments about food to avoid triggering anxiety. D. Focus primarily on the patient's emotional well-being. Answer: A. Monitor the patient's weight frequently to assess progress. Question 16. A nurse is teaching a group of nursing students about therapeutic communication. Which of the following is an example of an open-ended question? A. How did that make you feel? B. Did you feel upset when that happened? C. Why do you think that occurred? D. Tell me if you have any concerns about this situation. Answer: A. How did that make you feel? Question 17. Which of the following actions is most appropriate for a nurse who is caring for a patient with a history of aggression? A. Maintain a firm and authoritative tone when speaking. B. Encourage the patient to engage in physical exercise. C. Avoid confrontation and use de-escalation techniques. D. Physically restrain the patient to prevent harm. Answer: C. Avoid confrontation and use de-escalation techniques. Question 18. A nurse is caring for a patient who is experiencing a panic attack. What is the most appropriate intervention? A. Encourage the patient to talk about their feelings. B. Focus on deep breathing exercises to reduce anxiety. C. Offer the patient medication immediately. D. Leave the patient alone in a quiet space to calm down. Answer: B. Focus on deep breathing exercises to reduce anxiety. Question 19. When delegating tasks to a nursing assistant, which of the following should be considered? A. The patient's condition and stability. B. The assistant's availability to perform the task. C. The nurse's personal preferences and convenience. D. The nursing assistant's ability to complete the task. Answer. A. The patient's condition and stability. Question 20. Which of the following is the most important aspect of caring for a patient with dementia? A. Providing constant reminders about the time and place. B. Creating a structured routine to promote security. C. Encouraging the patient to engage in cognitive exercises. D. Allowing the patient to live independently as much as possible. Answer. B. Creating a structured routine to promote security. Question 21. A nurse is caring for a patient with generalized anxiety disorder. What is the best initial nursing action to reduce anxiety? A. Provide detailed information about all procedures. B. Instruct the patient to avoid discussing anxious thoughts. C. Encourage the patient to express feelings in a supportive environment. D. Schedule all activities early in the morning. Answer. C. Encourage the patient to express feelings in a supportive environment. Question 22. Which patient should the nurse assess first at the beginning of the shift? A. A patient with depression scheduled for group therapy. B. A patient with schizophrenia who has not eaten breakfast. C. A patient with bipolar disorder pacing and refusing medication. D. A patient with PTSD requesting a counseling session. Answer. C. A patient with bipolar disorder pacing and refusing medication. Question 23. A nurse is working on a mental health unit. Which task is appropriate to delegate to a nursing assistant? A. Escorting a stable patient to occupational therapy. B. Conducting a psychosocial assessment. C. Evaluating effectiveness of a new antidepressant. D. Educating a patient about side effects of lithium. Answer. A. Escorting a stable patient to occupational therapy. Question 24. A nurse is planning care for a patient with paranoid schizophrenia. Which intervention is most important? A. Encourage social interaction in group settings. B. Establish consistent and structured communication. C. Promote frequent changes in caregivers. D. Focus on discussing delusions openly. Answer. B. Establish consistent and structured communication. Question 25. Which of the following statements by a patient with major depression indicates a need for immediate intervention? A. I haven't been able to sleep for days. B. I just feel like a burden to everyone. C. I've stopped enjoying things I used to like. D. I don't feel like eating much anymore. Answer. B. I just feel like a burden to everyone. Question 26. A patient with Alzheimer's disease becomes increasingly confused at night. What is the best intervention? A. Turn off all lights at bedtime. B. Offer a caffeinated beverage to stimulate awareness. C. Use a nightlight and maintain a consistent bedtime routine. D. Leave the television on to distract the patient. Answer. C. Use a nightlight and maintain a consistent bedtime routine. Question 27. A nurse assigns an LPN to care for a patient with stable bipolar disorder. Which task is appropriate for the LPN? A. Initiating a care plan for the patient. B. Administering oral mood stabilizers. C. Providing patient education about relapse prevention. D. Evaluating therapeutic communication effectiveness. Answer. B. Administering oral mood stabilizers. Question 28. A patient with PTSD reports nightmares and poor sleep. What should the nurse assess first? A. Current use of relaxation techniques. B. Any use of sleep medications. C. Presence of suicidal thoughts or behavior. D. Amount of caffeine intake before bedtime. Answer. C. Presence of suicidal thoughts or behavior. Question 29. What is the nurse's best response to a patient experiencing auditory hallucinations? A. Ignore the voices and they will stop. B. Let's talk about how you are feeling. C. Those voices aren't real. D. What are the voices saying to you? Answer. D. What are the voices saying to you? Question 30. When a nurse identifies signs of burnout in a colleague, what is the best first step? A. Report the colleague to the nurse manager. B. Offer emotional support and encourage seeking help. C. Ignore it unless patient care is affected. D. Take over the colleague's assignment temporarily. Answer. B. Offer emotional support and encourage seeking help. Question 31. Which intervention is most appropriate for a patient with a phobia who is beginning treatment? A. Encourage the patient to face the fear immediately. B. Begin exposure therapy gradually. C. Avoid discussing the fear to prevent anxiety. D. Reinforce avoidance behaviors to reduce stress. Answer. B. Begin exposure therapy gradually. Question 32. A patient on a psychiatric unit is pacing and yelling at staff. What is the nurse's priority action? A. Call security immediately. B. Offer the patient medication to calm down. C. Approach the patient using a calm, non-threatening manner. D. Restrain the patient to prevent injury. Answer. C. Approach the patient using a calm, non-threatening manner. Question 33. A nurse is prioritizing patients. Which should be assessed first? A. A patient with anxiety, reporting nausea. B. A patient with depression, refusing to attend therapy. C. A patient with schizophrenia stating, I hear voices telling me to hurt myself. D. A patient with bipolar disorder watching TV quietly. Answer. C. A patient with schizophrenia stating, I hear voices telling me to hurt myself. Question 34. A nurse is educating a patient with schizophrenia about medication adherence. What is the most effective strategy? A. Reprimand the patient for noncompliance. B. Encourage family members to administer medication. C. Involve the patient in setting goals for treatment. D. Emphasize the negative effects of stopping medication. Answer. C. Involve the patient in setting goals for treatment. Question 35. A patient with depression reports difficulty concentrating. Which nursing intervention is most helpful? A. Avoid giving the patient any tasks. B. Encourage journaling and gradual task completion. C. Push the patient to focus harder. D. Recommend strict cognitive exercises. Answer. B. Encourage journaling and gradual task completion. Question 36. A nurse is reviewing assignments for the shift. Which task is most appropriate to delegate to the nursing assistant? A. Assisting a confused patient with toileting. B. Evaluating medication effectiveness. C. Teaching coping skills to a new patient. D. Monitoring behavioral changes in a manic patient. Answer. A. Assisting a confused patient with toileting. Question 37. A patient with bipolar disorder is in a manic phase. What is the nurse's priority? A. Encourage group participation. B. Provide a low-stimulation environment. C. Discuss the importance of medication compliance. D. Encourage journaling of feelings. Answer. B. Provide a low-stimulation environment. Question 38. A nurse is caring for a patient with a new diagnosis of schizophrenia. What is the nurse's priority action? A. Explain the illness using complex medical terms. B. Begin social skills training immediately. C. Build trust and establish a therapeutic relationship. D. Encourage the patient to return to work. Answer. C. Build trust and establish a therapeutic relationship. Question 39. What is the most appropriate response to a patient who says, "I'm worthless and my family would be better off without me"? A. You shouldn't think like that. B. Why do you feel that way? C. Do you feel like hurting yourself? D. Everyone has bad days sometimes. Answer. C. Do you feel like hurting yourself? Question 40. A nurse is reviewing the chart of a patient with schizophrenia. Which documentation is most concerning? A. Patient is isolating and not participating in group therapy. B. Patient reports hearing voices commanding him to act. C. Patient is compliant with medication. D. Patient denies hallucinations today. Answer. B. Patient reports hearing voices commanding him to act. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.